Hi and welcome to my YouTube channel. My name is Dr. Tolu, and in this video I'm going to be discussing 6 tips to get pregnant. Now, if you like what I have to say in this video, please hit the subscribe button, hit the like button, and leave a comment for me. In that comment, you can also let me know topics that you would like me to discuss, and I'll do my best to discuss them in the nearest future. Alright guys, without much ado, let's get right to it. So getting pregnant can be a tricky thing, right? You have some couples who don't make much effort. In fact, the pregnancy comes unexpectedly. Then you have those who make some effort and then they get pregnant. And then you have those that feel like it's taking too long for them. So in this video, these 6 tips are tips that can help you get pregnant sooner rather than later. Number 1 on my list is to have regular sex. Now, it's very important for couples who are looking to get pregnant to have sex regularly. Now, my definition of regularly, and a definition that's agreed upon by many medical practitioners, is to have sex 3 or 4 times a week at least, right? Now, that's if you're trying to conceive. Having vaginal, unprotected ejaculatory sex at least 3 times a week is best. So it's really important. I know it sounds like, of course, we know we're supposed to have sex, but then when you really look into it, a lot of couples who are trying to get pregnant are not having sex enough times. And once they start having sex 3 or 4 times a week, you just find that they conceive. So it's really important to have regular sex. Number 2 on my list is to monitor your cycle. Now, this is especially important for the women who are listening because you are the ones who have your menstrual cycles. It's very important to make sure that in as much as you're having sex regularly, like I said, at least 3 times a week, you are having sex especially during the period where you're ovulating. Now, it's really important because in your cycle, it's possible to get pregnant at any point in your cycle, right? But then there are points in your cycle where you are more likely to get pregnant, far more likely to get pregnant than other parts of your cycle. And this area of your cycle where you are most likely to get pregnant, where your chances of getting pregnant are higher than the rest of the cycle, is when you are ovulating. Now, you can track your ovulation by looking at the consistency of your vaginal secretion, and then even your basal body temperature may increase when you're ovulating. But one of the ways that I advise women to check if they're ovulating is to use an ovulation tracker, and then they urinate on it and that tells them when they're ovulating. Some use ovulation apps, right? Apps that can track and tell them when they're ovulating. I believe that these 2 methods are really good for you to know exactly when you're ovulating. And then for most women, at least generally, women ovulate 12 to 16 days before their period starts. But then my recommendation would be that you track it using maybe an app or using medical devices like an ovulation kit or strip. And number 3 on my list is that you carry your doctor along. Now, this is especially important for couples who have been trying to get pregnant for some time. If you have tried, let's say a young couple, both of you are maybe in your 20s or late 20s, you understand, and you have been trying for say a year, and the woman has never gotten pregnant, then it's important for you to see your doctor. Now, many couples even see their doctor before they start trying. Once they decide that it is time for them to have children, they see their doctor. And that's not a bad idea at all, because then your doctor can advise you, your doctor can run tests, your doctor would most likely tell the woman to start taking folic acid regularly, so that when she does get pregnant, the chances of the baby developing a neural tube defect are greatly minimized, right? Your doctor can help and go a long way. Now, for older couples, maybe if you've tried for about 6 months, women in their 30s and their partners, then you may want to see your doctor to find out why, because generally speaking, you may not have as much time with respect to your reproductive years, like say women in their late 20s or women in their teens, right? So it's really important to carry your doctor along. And number 4 on my list, this is particularly for women, although it can be relevant to men as well, and I'll discuss this in more detail in this point. Mind your age. Now, what I mean by that is this. Generally speaking, and this is not a hard and fast rule for every single woman in the world, but generally speaking, medical research has shown that a woman's peak reproductive years are between her teens and her late 20s. Right? What that means is, because women are born with a fixed egg reserve, that means a fixed number of eggs, unlike men who still produce sperm almost all through their lives, or even some all through their lives. Women are born with a fixed number of eggs, and as they age, that reserve decreases. Now, this is particularly important because by the time many women clock the age of 30, their fertility levels may start to experience a decline, and that decline continues as most women get older. So it's really important for women who are looking to have biological children to bear this in mind. Now, this point is not supposed to scare women, and it's not supposed to say, oh, if you are 35, then it's too late for you. That is far from the truth for many women, because even though fertility reduces for many women as they age, it is not the same for all women. Some women, their reserves can still be very, very good even when they are 35. Medical information is meant to inform you and to influence you to make the right decisions. And the right decision you can make, especially if maybe you're a woman in your 30s or in your 40s, is to work closely with your doctor. The reason why this is important is because working closely with your doctor or with a fertility specialist can help to increase your chances, because we have made giant strides in the medical field, especially with respect to reproductive health. So these days we are finding more and more women in their 30s and even in their 40s getting pregnant and then having healthy pregnancies and then giving birth safely. In fact, one of the fastest growing groups of women who are currently getting pregnant and giving birth to healthy children are women in their 30s and in their 40s. So all hope is not lost, but just bear this information in mind, because in truth, generally for many women, fertility starts to dwindle from the age of 30. So mind your age. And even for men, but for men, men in their 50s and 60s still have enough healthy sperm, right? For most men. So it does not really apply strictly or as urgently to men as it does to women. So bear this in mind, mind your age. Now, number 5 on my list is to be careful of your choice of lubricants. Now, lubricants are very helpful, especially when it comes to spicing up sex, or for women who may have maybe some difficulty with lubrication, vaginal lubrication. Lubricants can go a long way, right? But when you're looking to conceive, it's important to be careful about the kind of lubricant to use. Now, lubricants that are generally good for reproduction are, say, pre-seed oils or say mineral oils, but then you want to avoid lubricants that contain some kinds of ingredients like lubricants that contain sugars or flavoring or glycerin or silicone. You want to avoid lubricants like that. So you have to be careful with your choice of lubricants when you are looking to conceive. And number 6 on my list is for you to take care of your body and your mind. For couples who are looking to get pregnant, it can be a time of some level of anxiety and you wanting it to happen really fast, especially if you have been trying for a bit of time. But one thing, and this is especially important for the women, that we have realized is being anxious about it may even affect your chances of actually conceiving, and it affects it negatively, which means that being anxious, being worried can reduce your chances of conceiving. So it's important for you to keep your spirits up. It's important for you to communicate with your partner, because this is a situation that both parties are going through. So communicate with your partner, open up distress. That means that's DE, stress. Don't stress, basically. And if you're stressing, get rid of the stress. It's also important for you to keep a healthy body, both man and woman. It's important for you to be healthy, exercise, eat healthy, cut out smoking, right? Reduce your alcohol intake. And even after you conceive, it's very important for you to completely stop your alcohol intake, because that can lead to some complications. Drinking alcohol in any quantity might lead to some complications with the baby. So it's important for you to keep a healthy body, keep a healthy mind during this period where you're trying to conceive. Alright guys, so those are 6 tips that can help you get pregnant sooner rather than later. And I hope that these tips, you find them helpful in your journey to conceive. And I also hope that very soon it happens for you, because one of the joys for a lot of couples is having children, raising children. It gives a sense of fulfillment, and when you talk to many couples as a whole, it is something that they will not trade for anything in the world. Alright guys, so I hope you found this useful. If you like what I had to say, hit the subscribe button, hit the like button, and leave a comment for me letting me know how useful you found this video. So till next time, bye.